Hello, my name is Anne Russell and I'm from the Russell Family Fetal Alcohol Disorders Association. Recent CDC advice on alcohol and pregnancy has been considered by some to be overly patronising. The CDC advised women who are drinking to use contraception, and for those women not using contraception, not to drink. I don't understand why women would take exception to this advice. I'm a woman and I haven't taken exception to it. But then again, I've got first-hand experience of the consequences of alcohol and pregnancy, which those people who seem to be disrespecting don't have. I'll go through some of the problems my youngest child and I went through because this advice wasn't available when I was pregnant with my children. The following is a general compilation of the typical trajectory of a child with FASD. Much of it is what happened with myself and my son. At 0 to 12 months, my son cried all the time. He didn't thrive. He was developmentally delayed, was at the doctors all the time, every week at least, for infections and colds. I was tired, really tired, because he didn't sleep. I spent huge sums on doctors and medications, but nothing seemed to work for him. I didn't have time for my husband and our relationship was strained. I thought it would be a joyful time, but I didn't notice because I was so crushed for fears for our little baby. Doctors and other professionals disregarded our problems until my baby was 6 months, and then the paediatrician said that he might be retarded. I don't know why he said that, but it was a shock. Between the ages of 2 and 3 years, my son was demanding. He didn't have any friends, had tantrums that defied understanding, had caught up developmentally, but only for a while. If he didn't have 24/7 supervision, he'd run away. I loved him dearly, but I couldn't understand this behaviour. Stressed and confused, I went to many doctors who all told me to take parenting classes. So I did. I attended Triple P, but nothing they suggested seemed to work for him. There was a difference between my son and other children his age. At 5 years of age, he was in prep, but not doing well. He'd been told to leave one school. He was sliding back and was not at a par academically with other children. He was always sick and had no friends. He was beginning to see that he was on the outer, and he started asking why. And this is where my frustration came in, because he was very verbal, but he couldn't seem to comprehend a lot of things. I was tired and stressed. My relationship with my husband wasn't ideal. We tried to go on holidays but came home early. It just didn't work. I knew there was something wrong. At 10, he was in year 4, but he was developmentally maybe 6. He had already exhibited inappropriate sexual behaviour, was slow in literacy, math and language skills. He refused to do homework and was always unwell. I was diagnosed with an anxiety disorder and went on medications. I was also depressed. I didn't know what was wrong with my little boy. There was always tension when he was around. What was he going to do next? What was I going to find when I came home from work? Where would he be and who would he be with, and what was he doing? The school rang almost daily. He was constantly in trouble and had started missing school. At 15 years of age, he'd been stealing, was always asking for money, and started drinking and using drugs years ago. He was being manipulated by peers, stealing cars and fighting. He was known to the police. He would not attend service providers because he'd been to so many, he was sick and tired of them. They never did anything to help him. That's what he said. In fact, they used models to describe the various things they wanted him to know, but he didn't understand them. None of us knew why. The last time he just said there was nothing wrong and that I was overreacting. So that got me a slap from the community mental health manager and a kick out the door. The neighbours began complaining we couldn't leave him alone. He became increasingly aggressive and volatile, unpredictable and violent, and eventually became paranoid and psychotic. The police often came to our home. I was exhausted. There was no one to go to. No doctor would help. My physical and mental health began to suffer. In those days, it didn't take much to stress me. Now, that's only till 15. I won't go any further. FASD is a lifelong disability. I think it's pretty clear how this ends. Incarceration, mental health, drugs and alcohol, violence, suicide attempts, friendlessness, and ultimately it's possible that these suicide attempts will succeed. So that's why I implore women not to dismiss the CDC's guidelines on alcohol and pregnancy. If you think you'd like to learn more about FASD, we have quality professional training available on all aspects of the condition through Training Connections Australia. Please contact me, my name is Anne, on 0412 550 540. Thank you.